Welcome to the KTAL News Now Digital Streaming Center. I'm Brittany DeFran, and Preeclampsia Awareness Month is recognized in May, and World Preeclampsia Day is highlighted on May 22nd, which has encouraged health experts to educate communities on this rare, life-threatening condition. And joining me now to share the top symptoms and risk factors is Dr. Brian Caveney, the Chief Medical and Scientific Officer at LabCorp. How are you doing today?
I'm good, Brittany. How are you?
I'm doing great. I think this is a really important topic that may be new to a lot of people to discover the risk factors and symptoms and how to just be aware of it, if you're carrying a child. So just jumping right in here, I understand that preeclampsia causes pregnancy complications, but what is the direct impact to the body of a woman who is carrying a child?
Well, the real problem is the placenta doesn't develop appropriately inside the uterus, and that can cause a variety of challenges with your cardiovascular system, especially high blood pressure. And that can then in turn cause a lot of other organ damage, especially your kidneys and liver and a few other things, and sometimes even result in seizures. So terrible impact on the placenta, the baby, and the mother, unfortunately. All the more reason why we want to catch it early and then intervene where possible to try to get to a healthier pregnancy.
Absolutely. So, would you say that high blood pressure would be one of the risk factors in regards to being diagnosed with preeclampsia?
It most certainly is, but unfortunately there are a bunch of other risk factors from family history, a personal history of having had preeclampsia with a prior pregnancy. It's also pretty highly correlated with advanced age during pregnancy, obesity in the pregnant mom, and a variety of other conditions. You mentioned high blood pressure, but also type 2 diabetes, liver disease, kidney disease, and autoimmune disorders, so things like lupus or rheumatoid arthritis. So a lot of things for you and your doctor to think through at the beginning of a pregnancy to evaluate your risk for preeclampsia and a lot of other conditions.
So this is something it sounds like, of course people deal with while they're pregnant and maybe the risk is even higher during that time. But are there long lasting impacts after being diagnosed with preeclampsia?
The good news is that it only really happens when you have a placenta because of the interaction with the blood vessels. And almost all the time after delivery of the baby and the placenta, it goes away unless the high blood pressure was not treated and it caused some end organ damage during the course of the pregnancy. Again, usually liver, kidneys, and a few other organs like that. So that's why it's just so important to get on this early and then be sure that it gets adequate treatment.
Absolutely. Yeah, you talk about really two important things right there is spotting the symptoms and treatment. We'll jump into the treatment here in just a little bit, but how can someone detect symptoms? What are the symptoms that someone is looking for?
That's one of the challenges because we can't feel our blood pressure and we can't feel if we're getting anemic or a few of the other things that show up in preeclampsia, like spilling protein into your urine. One of the reasons why doctors need to evaluate all of those different risk factors and then in some cases screen the pregnant person to see if she's at increased risk of developing preeclampsia during the pregnancy.
Absolutely. And then, kind of looking more into treatment, what is available in regards to treatment?
Well, unfortunately, there's no cure yet because we don't know exactly what causes it. However, there are a variety of things that your doctor can do if the tests suggest that you are at an increased risk. And so if your blood pressure is elevated, for example, they can put you on one of the medications that we know to be safe during pregnancy. They can make sure that the other conditions that you might have, such as diabetes, are well taken care of and well controlled during the rest of the pregnancy. They might increase the frequency of visits for prenatal care at the clinic. They may ask you to monitor your own blood pressure in between visits and let them know if it's above a certain range, for example. So a variety of things like that they can do. Many times they also will put the person on a low dose of aspirin for the rest of the pregnancy if they aren't at risk for a bleeding disorder, and a variety of other things. So no cure except for delivery of the baby, but a whole lot of things that your doctor can do along the way, including evaluating how active you are either in your job or in your home activities to make sure that you're not putting yourself at an increased risk of a problem.
Absolutely, yeah. I kind of seen this. This has been seen a little bit through maybe some more well-known celebrities, where I've even seen them bedridden during that time. As you mentioned, the activity. Yeah.
Yeah, that's
Sorry, I
right.
thought.
Everyone's a little different.
Yeah.
Sorry, go ahead.
No, no, no. Go ahead. I think there's a little delay here, so I thought you were gonna say something. It took a moment for you.
I was just going to say that everyone's a little different, and it's important to think about any other condition or medication the person is on. That's why it's just critical to have your doctor evaluate all of these risk factors, order, blood pressures, diagnostic ultrasounds, and a variety of different lab tests that are available to help make sure they're taking the best care of you they can during your pregnancy.
Yeah, it definitely sounds like it's something that it is kind of newer and developing and finding out the facts of it and how it impacts women, especially during pregnancy. Something that I thought was very interesting was that Black women are 60% more at risk compared to others. Do you know why that is?
We don't know exactly why that is, whether it's a biological, physiological thing, or whether it has to do with access to appropriate care, insurance coverage, a variety of other things like that. But the fact that that disparity exists is another reason why it's important for all patients and all doctors to understand what options exist out there, do the best they can to identify these conditions early, and then implement the right recommendations and treatments to try to minimize the risk and hopefully improve the chances for a healthy pregnancy and a healthy delivery of the baby.
Absolutely, and this month, one of the ways to get that information out there and make people aware that this is a possibility that they could, be diagnosed with preeclampsia, and to just understand the symptoms and watch out for that during pregnancy. So, thank you so much, Brian, Dr. Caveney, for giving the information to our community and helping us be more aware. We really appreciate your time. And you guys, for more details, you can find it all right here on ktalnews.com. Thank you so much for joining us. Hope you guys have a great rest of your day. We'll see you next time.